Hello, I'm Dr. Vail Garvin, President and CEO of the Central Bucks Chamber of Commerce. Welcome. Today we have with us Kim Everett, who is the Executive Director of BCHIP. Why don't you tell us what BCHIP stands for, Kim, and welcome.
Thank you, Vail. It's so nice to be here with you today. So that's a great question because we get it a lot. A lot of people think that BCHIP is CHIP, the Children's Health Insurance Program, but we are not. So it is the Bucks County Health Improvement Partnership, and that's what BCHIP stands for.
And I'd love, before we get into what BCHIP actually does in the community, which, by the way, is a lot, and I'm so grateful for these test kits, talk to me about you, Kim. What's your background?
Oh, so I have...
It's important.
Thank you. Thank you.
You're awesome.
You're so supportive. Thank you. I have been very fortunate to spend my career here in Bucks County. I started out with an undergraduate degree in athletic medicine at Lower Bucks Hospital.
Know that. How about that?
I did, and so I was one of the first certified athletic trainers in the area. I was the first certified female athletic trainer in the area. And so, so I started my career at Bristol Borough High School, and I grew the program there for Lower Bucks Hospital. So we expanded and provided athletic trainers to the schools to take care of the athletes.
That's
there.
Wonderful.
So that was a fun start to my career. I always joke and say I have no idea why they hired me when they did. I was new grad out of college, but I was fortunate to grow and really appreciated the work that I did there when I was there. And as we know, things are always changing in healthcare.
Truly.
So the hospital...
Hopefully for the better.
Always, always. So the hospital changed ownership at that point, and they really decreased the community outreach programs at the time. So I was fortunate enough through BCHIP, interestingly enough, to have met Sally Fabian, who is my predecessor as the executive director of BCHIP. Okay. But she was the director of the health department at the time, and she said, "Oh, would you like to join us there?" So I was able to go to our county health department, where I worked for 14 years.
Really?
Yeah, I was a contractor there, and I ran their injury and violence prevention program. And I was very fortunate to work part-time, so I was able to be the mom that I wanted to be at the time.
That's really special.
It was great. It was a great time.
Yeah.
And then when my kids got a little older, I learned about a position at St. Mary Medical Center in their trauma prevention program, because St. Mary was our only trauma center at the time. And by their standards, they needed to do prevention work. And so I joined their team for about 10 years. And so those experiences, I think, are what positioned me so well to really enjoy my experience at BCHIP, because I've had experience in both the public health world and the clinical and hospital world. And so I'm able to...
Excellent background.
Yeah.
Excellent background. Can you talk just a little bit about who all's involved with the Bucks County Health Improvement Project and what the goals might be?
I was part of it when it started. And so BCHIP is a really unique organization.
It is.
And you know, because you had been involved at Warminster Hospital years ago. So for 7 competing hospitals at the time to come to the table and say, what can we do better together than we can do independently?
See, I love that about the Bucks County community.
I do too.
Yeah.
And so I feel really fortunate. And so I was part of that initiative when it started, because I was at that point at Lower Bucks Hospital in charge of their wellness programs.
So what year was that?
So roughly 94.
Okay. All
94,
right.
95. Okay. So as the wellness director there, I sat on the BCHIP Wellness Committee for Lower Bucks Hospital, which interestingly enough is still the only committee that is still meeting regularly after all these years.
Oh, good for them.
As it was originally designed to, yes. And so the goal was, really to just look at opportunities to work collaboratively together, and they stood up some committees. There was the Transportation Committee, the Access to Care, Domestic Violence, the Wellness Partnership, a few other committees.
Mental health?
I don't
Or did
know
that
if
come
mental
later?
health was one of the originals.
Okay.
I think that may have come later.
Okay.
And so they did great work. They, through in those years, they did. If anybody's ever seen the placards in the ladies' rooms in some of the restaurants or hospitals. That was all work through BCHIP around domestic violence.
Huh,
Yeah.
good for you.
So they did really good work there. They collaborated on things like blood pressure screenings and skin cancer screenings and all those types of preventative services to try to make sure they were spreading out dates and spreading out times and making sure we were meeting the needs of the community, whether it was in the evening or weekend. So, and then we know that access to care was a priority. And so Sally did a great job of standing up a clinic in Bensalem to provide care to those who were under or uninsured. And I believe
That's not easy.
not at all.
It's not easy.
And they also had a dental clinic available. And so they did a wonderful job of providing care there. However, again, healthcare is always changing, right? And so our BCHIP board felt that while that was truly important, that BCHIP had kind of lost its overall mission. And even I personally living in this community, you know, the clinic was a wonderful thing, but if you asked anybody what is BCHIP,
They didn't know.
they said a clinic in Bensalem,
Yes, got
right?
it.
And so it kind of lost that bigger vision of looking at those gaps and addressing, you know, more than just that access to care gap. And so the board decided they wanted to redirect back to the original mission of saying we care about those patients and we want to make sure their needs are met. However, we want to go back to addressing the larger gaps collaboratively among the 6 hospitals. So they transitioned away from clinical care and they decided that St. Mary would take over that clinic. So those patients still have their needs met as they needed to, but that we were going to bring BCHIP back to that mission of how do we work with our hospitals, our health departments, our community partners, our government agencies to really look at what those gaps are and how they can work together to resolve them or improve them.
So Bucks County is so fortunate to have so many hospitals. Which hospitals are involved with BCHIP in the county so that everyone knows?
No, I appreciate you asking. So there's 6 hospitals in Bucks County. So there's St. Luke's Upper Bucks, which is part of a larger health system, as we know, that goes north of us, but they are in Bucks County and committed to BCHIP. Grandview Health is part of our organization. Doylestown Hospital. We also have St. Mary Medical Center. We have Jefferson Bucks, which is part of the Jefferson Health System, and we know that St. Mary is also part of Trinity, the health system there. And then we have Lower Bucks Hospital, which is part of the Prime Healthcare organization.
It's pretty awesome.
It is. And that's one of the unique changes with BCHIP is that when it started, all those hospitals were independent hospitals.
Yeah, that's interesting.
So, you know, it's great to have the resources of a larger organization behind them, but sometimes it does make it a little bit harder for our hospital partners to be engaged with BCHIP because they have to do things that are network-wide or, you know, organizational.
So bringing it to current day, what do you see as, say, the top 3 issues that Bucks County is facing? Do you mind if I ask?
I'd be happy for you to ask, and I'll say it 3 times. Mental health, and mental health. But in all kidding aside, when I started this role 3 years ago, it was 8 months before a COVID pandemic broke out. And when I met with all 6 of our hospitals and our county commissioners, our county leadership, David Damsker, our county medical director, and I said, what should be the priorities for BCHIP? Every single one of them single-handedly said mental health and substance use disorder. And then from there, certainly access to care and, you know, chronic disease management, things of that sort pop up. But I did find that really interesting. And so then a COVID pandemic broke out, and BCHIP really secured our role in the community for the next 100 years.
In what way?
So we did exactly what we were designed to do. As the hospitals identified and the county identified gaps, we tried to fill them. Now, can I act like we filled them all? Absolutely not. Do we know from a public health perspective, we've learned a lot from the pandemic? Absolutely. But when the hospitals needed to have a form of communication around clinical care and best practices, we had meetings stood up. When they needed resources around supplies and working with our county to secure supplies as needed, we were the conduit for that, right? when we needed to be looking at emergency response teams or emergency response plans, we were able to make sure that our county was connected with the hospitals in their efforts around that. And I could go on. And so we convened meetings with hospital leadership for 2.5 years throughout the pandemic.
Well, thank you on behalf of our community. Seriously.
Thank you. You're welcome. And it was an honor to be involved in that work, at least most days. But there are a lot of challenges, but I was really happy to see that through all of it, our hospital leaders and our county remained committed to trying to work together to resolve those problems. Yes, it was really great. We had some hiccups along the way, for sure. Some of them, more public than others, but certainly there were some hiccups along the way.
There's always that.
Yeah, everyone's not always going to agree, right? Exactly. Yes. But we really were able to make a difference. Yeah. And so because of COVID, we built relationships. We built relationships when we knew that the hospitals were offering COVID vaccine and that they needed to get those out to our community health providers. We stood up relationships with Lenape Valley, Penn Foundation, and Nova, and all of those folks that were addressing the behavioral health needs in our community to make sure they had access to vaccines and COVID testing. And so we really were that connector and that conduit to meet the needs of the community through that work. And so we know, as you say, where are we going, right?
Exactly. We
know that mental health and substance use disorder
I hear that all the time, Kim, in our community.
They need to be our priorities.
Yes.
We're really fortunate. We're a county that has a lot of resources, but we also have some gaps, and they're not just gaps in Bucks County, they're national gaps. We need psychiatry. We need more help in mental health resources. We need people to have better access to mental health when they need it. And so we are working very hard to try to connect, whether it's our behavioral health providers with our acute care hospitals or acute care hospitals with our county resources. And we're working very hard to connect the dots on some of that work and identify new ways of doing things.
I know that the hospitals often have difficulties in the ER trying to manage patients that need mental health care.
They do.
Is that correct?
Absolutely correct.
Are we going to be putting up any crisis centers or?
Well, we're hoping to in the future. I can tell you that we know nationally that an acute care hospital emergency department is not the best place for a patient who is in mental health crisis. And there's a lot of research that shows us that. Our hospitals care very much, all 6 of them, and I believe certainly well beyond our county, care very much about the mental health needs of patients. But they don't have the resources to really be addressing all of those needs. So I do think we need better collaboration between our behavioral health providers as well as our county agencies to see what resources we can identify.
And the schools, the universities and the community college.
Absolutely, and the schools. Thanks for pointing that out. You're right. To see how they can work better collaboratively to address those needs. So do I think there's a need for a crisis center? Absolutely. But I know we're working toward that goal here in the county. Exactly what that looks like yet still remains to be seen.
But the fact it's being worked on
is
great.
It is, absolutely.
It's really super.
It is.
You are a tremendous woman and a great leader, Kim, and we are so grateful to have you in this community in this capacity. If you were to say 1 or 2 more things to the business community before we close, what would they be?
That's a great question. Well, first of all, thank you for the compliment. And I share with you all the time that you inspire me to do this work, so I appreciate you just as well.
Thank you.
And so I think what I would say to the business community is there are a lot of resources that you're probably not aware of.
See, I really agree with that.
Findhelp.org is a great resource that BCHIP is getting more involved with. It's not our program.
I'm not familiar with that.
It's not our program. It's a national program, but it's a website you could go to find support when you need it. So employers can use it, the general community can use it, community agencies can use it, caseworkers, social workers. We're moving forward with a project to bring that more to the forefront in our community. So I think if I was to say, what do I want to tell the employers, that is start, that's a good place to start looking for help should you
Does
think
that show local assistance as well?
It does.
Okay.
You just put in your zip code, and it has all local resources in there. And you can even send the link to your colleague, or your colleague can search confidentially. And so I think that's a great resource for our employers to use to try to help to support their colleagues as need be. And I think the other message is that BCHIP needs to grow. There's gaps, and identifying those gaps and then identifying the resources to support it need to be a priority.
So how do you grow?
So we need to secure more funding in the future.
Okay.
So that we can grow our staff. We have our advanced care planning program that's a historical program and can support employers and employees to complete their advanced directives, living wills, healthcare power of attorney forms. It's all free.
So you would do that with the HR department of, say, Pencolor, or okay.
We could. We certainly could. We have smoking cessation classes that they can take advantage of. That's grant funded. We recently received funding. Most of our funding is grant funding that is program specific. So we now have the grant funding for immunizations for homebound, so that we can
That's
reach out to
wonderful.
them. So lots of programs, but some additional support to make sure we can better connect the dots in our community is really what we need to do.
Well, thank you so much for being here today and for talking to the business community and the community at large, for all that you do, Kim. God bless you.
Thank you.
Thank you. This is another edition of Chamber Chat.